Have you had your testosterone added to your blood work, but you're not quite sure how to read it or what the ranges mean, what the units of measurement are? I'm going to explain that for both men and women. And I think it's important for you to know because when you talk to your doctor, you want to know where you fit in and line up how you're feeling with the scale that they've provided, because those blood work panels, they're set up for what's typical, right? Or even typical for a particular age. And your doc may say, hey, that's normal, meaning it's normal for someone your age, someone in their 40s, someone in their 50s, someone in their 60s. But you're not thinking about getting testosterone replacement therapy because you want to be typical or normal for someone your age. You're trying to optimize, right? You want to have optimal performance, which means optimizing your testosterone levels. And that's going to be a balancing act between what your range is on your blood work and how you're feeling, how that's helping you perform. So let's get into it with men first. Typically, they're using the metric for men is going to be in nanograms per deciliter for both your total and free testosterone. And your typical range for total is going to be right around 190, 195 up to about 740, 750. With the free testosterone often also being in nanograms per deciliter, somewhere between 4.5 to 25, okay? And so the difference between total and free, total is the total amount of testosterone that's in your body. But the free is like what's available for your tissues to absorb. And one way I've heard it described pretty well is kind of like total testosterone is like all the money you got, right? All the money in the bank, all the money in investments, all the money in your pocket, okay, that you can ready to spend right now. But the free testosterone is like just the cash in your pocket. It's what you got available right now to use. And so if you think of it that way, the free is much better thing to look. Not you don't look at the total, you don't consider the total, but the free is going to give you a much better idea of the amount of testosterone you have available to use, and that's going to make you feel optimal. And two people can have the same total testosterone levels, but have very different free testosterone levels that can be affected by different things like stress, age, other factors, okay? While we want to know the total, and when you keep an eye on the total, the free is going to tell us a whole lot more about how you're feeling, what's going to be available for you to perform at a high level. So again, back to the nanograms per deciliter. While they tell you the total range of 193 to 740, normal, if you have anything below 400, you're probably not going to feel too good. And that's just my opinion. Now, again, I want to preface this by saying, I'm a little late for a preface, but I'm not a medical doctor. I'm not a nurse. I'm not a tech. I don't have a medical degree at all. This is coming from my personal experience with my own hormone replacement therapy, that of my wife's experience with hormone replacement therapy, and the clients that we both have that are on hormone replacement therapy. And I work with a lot of my clients on there. My wife is a nurse. She works with many clients who are also on hormone replacement therapy. So we've seen a lot of labs. We've seen a lot of people really change their outlook on life with hormone replacement therapy. And they all say it's a game changer, right? They just feel better, perform better, and are more resistant to disease. So I'm a big fan of hormone replacement therapy, but it's good for you to understand it when you go talk to your doc so you can advocate for yourself. So back to the ranges. I keep getting sidetracked, but I want you to understand how important this is because it can really change your life. It can change your career, your performance in your career. When you can transform your energy and your resistance to disease and your performance, your mental energy, your physical energy, your mood, when you're taking on challenges, trying to solve problems, and just live a fun life, right? This can be a vital part of that. It's going to be one tool in your toolbox that helps you do that. So that range of 195, 740, again, below 400, you're probably not going to feel too good. That's definitely on the low end, all right? And 750 should not be considered dangerous as a high end if you get up there. I know plenty of people, and this is anecdotal, not a medical doctor of any kind. Above 750 is not dangerous. I've seen people go 800, 900, 1,000, feeling great, looking great, no risk, no side effects, no negative side effects. And the doctors who were overseeing them thought it was fine as well. So again, this is a person-by-person situation. So get with your doc, figure out what works for you. As far as the free testosterone goes, at 4.5 to 25, 4.5, you're definitely going to feel pretty bad. You're going to feel pretty old, run down, and it's not ideal. I think anything in the single digits is not ideal, okay? If you're in the double digits, you're up in the 11, 12, 13, 14, 15, and you're in your 50s, hey, you're doing really well. You're doing better than average. In fact, you're probably doing better than most 45-year-olds if you're up in that teen range, 11 to 20. Okay. But be aware as it's dropping, keep tracking it as it's dropping, because when it gets in single digits, you might decide you need some therapy. You might need some hormone replacement therapy. But I would guess that most doctors are probably not going to recommend you start on that if you're in that mid-teen range, 13 to 17, 18 range. You're going to be feeling pretty good. Okay. But when the single digits, you're going to start replacing it. When you replace it, figure out what's best for you. You might find that just enough, whether it's a cream or a shot, that you use to get it up there, you might find that the teens are fine for you. 15, 16, 17 feels pretty good. Or you might find somewhere from 20 to 25 or even as high as 30 nanograms per deciliter is where you want to be. Find what's right for you, talk to your doc, figure it out, and with the upside, downside, how you feel, right? Any side effects might be with like your skin, kind of breakouts, oily skin, maybe a little extra edema, a little extra swelling. So water retention, things to watch out for, okay? But things you can manage by just backing off a little bit. Many people find if they're up around 30, their free testosterone's up around 30 nanograms per deciliter. If they back it off to 20 to 25, they feel pretty good. The side effects go away. That just might be reducing your dose just a little bit, okay? Now, with the ladies, with your totals, they might have it in nanograms per deciliter. The range for that was going to be probably like 2 to 45-ish. It might be 2 to 50. Depends on the lab again. And that's in nanograms per deciliter. Now, for many times with women, they put it in the picograms per milliliter. So if it's in picograms per milliliter, and for some reason you want to switch it to nanograms per deciliter, you don't have to. But it's a difference of a tenth. So the number, let's say 20 in picograms per milliliter is the same as 2 in nanograms per deciliter. Guys, if they send your free testosterone back and it comes out at 200 picograms per deciliter, look at the metric. It's just to say picograms per milliliter, move that decimal point over. So from 20 to 2. And that's going to be an interpretation of from 20 picograms per milliliter is going to be 2 nanograms per deciliter. So it's an easy change. And I'm sorry if this sounds confusing, but it can be even more confusing when you get your labs back and you've gotten labs from 2 different lab groups and you're seeing different units of measure. Unfortunately, isn't a super solid standard of unit of measurement. The balance between these two and when they use it for who, for whether it's total or free, is completely up to that lab. And so I think it's helpful to know how to interpret that so you can interpret it between 2 different lab results or different labs that are using different metrics. So ladies, again, if you're around 2, you're probably not feeling too good. That's a low end of the range. If you're up closer to 45, you can even go above that. Some people really enjoy being above 50 or even 100. My wife likes hers up around 100. Now, I'm not telling you to go to 100. That's her. She tends to like her testosterone very high. She feels better there. And again, she works that out with her doc. She's managed by it. Even though she's a nurse, she runs that past an NP and a physician, and she gets feedback from them on it. Okay, even as a medical professional, just to make sure she's right where she needs to be without risk and making her feel good, which is the purpose, make her perform at an optimal level. Now, as far as free goes, the range is 0.1 to 6.4. Usually that's in PG because the numbers would be so low. If you did that in NG, it'd be like 0.01 to 0.64, which the numbers are just too low to work with, right? That just doesn't make sense. So for ladies, your free testosterone would probably be in picograms per milliliter. The range is going to be 0.1 to 6.4. Again, you can push that 6.4 higher if that feels right for you. Start with the normal range. Start somewhere in the upper end of that, right? The upper half of that for sure. Like somewhere in the 3 to 6 range and see where you feel. And if that's good for you, then great. It's not a competition, right? It's not about what someone else's numbers are. It's about what your numbers are and how you feel. Some docs will tell you, oh, we just go by the range. And some will say, I just go by how people feel. You really need to go by both. Look at the range, make sure, see what's close to normal or where you are, where you like to be, and then how it feels to you. Is it getting rid of those symptoms, some of which I talked about in my last video, with the 10 benefits of testosterone replacement therapy for men and women. If you haven't seen that, go back and check that out. Again, it's 10 benefits of testosterone replacement therapy for both men and women. And I named what I consider the top 10 benefits. But you want to realize that these ranges were set up by labs based on population-wide measurements, okay? So again, they're fitting you into a normal range, which may not be what's best for you, especially when you're optimizing. And so what's optimal is rarely what's normal, okay? So if you're at the upper end of their normal ranges, you might be fine. I would definitely aim for, in general, the upper end of these ranges that I'm telling you to start and then play with that and see how you feel. So again, for men, the range for total, 190, 193, and 195, about 740, 750 nanograms per deciliter, okay? If they come back in PG, that's going to have another 0 on it, which is crazy. It's going to be 1,930 to 7,400 if it was PG. Now, hopefully they don't do that to you because that's just confusing and silly. But nanograms per deciliter, 190, 740, 750. Free is going to be 4.5 to 25. Aim for that upper range closer to the teens or 20, like 15 to 25 in nanograms per deciliter. If they give that to you in PG, that's going to be out of 0. It's going to be 45, move the decimal point over 1, 45 to 250 picograms per milliliter or PGML for guys. And again, you can move that decimal point back and forth, just whichever one is you feel like you want to deal with, but most of it's going to be nanograms. For the ladies, the total is 2 to 45 nanograms per deciliter. And again, aim for the upper range of that for sure, upper range to start, and then figure out your total that is best for you. And then look at your free. Remember I said before, the focus is on the free. That's really going to give you the finest, like my finest, more precise metric for how you're going to feel. And that was the 0.1 to 6.4, but don't be afraid to go higher than 6.4. If you feel like once you get to 5 or 6, you're like, I think I got a little more room for improvement. I'm not feeling any negative side effects. Give it a shot. Talk to your doc, talk to your NP, nurse practitioner, see how it feels to go up a little bit. So I'm happy to answer questions. If you have any questions, put them below. This can be a little bit confusing, I know, because of the change in metrics, but it's well worth you understanding it, again, so you can be your own advocate when you talk to your medical professional who's helping you with this and explaining that, hey, I'm not here to be normal. I'm not here to be typical for my age. I'm here to be optimal, right? I want optimal performance, and I think I've got room to go up. I got room and be a little more on top of my game than what the typical normal ranges are, if that's what's right for you. So don't be afraid to speak up for yourself and let your doc know how you're feeling, and push back a little bit if you need to, because this is your life. It's your health, and you don't need to be confined by what these labs are seeing as the normal ranges for what we know is a predominantly fairly sick and underperforming population.